Welcome back to IACI TV. I've been joined by Zuzana Diamant, who is going to be talking to us about asthma. And an interesting thing about asthma, which it hadn't occurred to me, is that people are now being encouraged to exercise. What is the link between exercise and asthma?
Well, thank you for asking. I think it's very important in general. It's a very important topic to be discussing exercise in the context of disease and health. So exercise, specifically for asthma, has been seen as an indispensable asset for people to keep on going, as to say. And on time, it also improves lung function, along with the condition in general.
So has it always been a recommendation? Because I believe from quite some time ago that asthma sufferers were actually encouraged not to exercise because it could induce asthma attacks.
And the point is that exercise can be both a foe and a friend. That is so true. But in general, if you do it, for instance, outside of dramatic exposure, be it to gas and to environmental challenges in the air and outside of heavy pollen season for those who are sensitized, it will be pretty much recommended. And I have to admit that this is not my major area of expertise within asthma. It's more in allergy. But within our asthma section, we have some great experts in exercise. For instance, Mariana Couto and Matteo Bonini is also in exercise. And together with Sven Seys and with some good colleagues from the ERS, we have recently formed a task force that's about to kick off at the ERS Congress. So I hope that I can tell you more next year about this topic.
Okay, so what are the areas that you're focusing on right now?
Well, the most important area that I am in, and I have been in already for 25 years, is the development of novel targeted drugs. And obviously the past 2 decades have been really gorgeous for those who enjoy this part of sports, I would almost say, because there have been an expanding number of targets these days to target in order to control the more severe types of asthma. And you will see around this Congress quite a few talks and very good presenters who provide an overview. This morning I chaired a session with Chouab Nasser from the UK and Param Nair from Canada, very good colleague also in biomarkers, and Jocelyn Juste, she's in Paris. So it was very exciting. And I think for patients especially, it is good that these biologicals are now entering the clinical practice for many indications like asthma and comorbid conditions like nasal polyposis, skin atopies, etc.
So there's a lot of really good news in the asthma field, but what are the real challenges that you all still face?
Yes, I think that is a very good question, because challenges, we always have a lot of challenges. So behind every great target, behind every great invention, there is actually also great challenges. So the challenges now are how to implement biologics and also biomarkers and the other strategic approach being called precision medicine into the clinical practice. So that's also something that we have been discussing here a lot of times, and many sessions are also devoted to this.
You were saying to me before we started the interview that you're involved in task forces and you've got like nearly half people from the Netherlands and half from the Czech Republic, which is where you're originally from, and you're now working at Lund University in the Netherlands. What is the work that you're doing in the task forces?
So I think task forces are great because there we can, in fact, reinforce our strengths. And what we try to do from the asthma section in the past 2 years is to be very inclusive also for colleagues who have been part of the other sections, so both within the section and trans-sectional, if you wish, but also involving many people from my international network to task forces. So usually specific task forces, like now the Czech, Dutch, and also UK, of course there are also other people inside, is about eosinophils. And because eosinophils have been traditionally seen as the very, very important key cells in asthma, now, of course, also some diverting ideas are coming in about the inflammatory phenotypes, endotypes, etc. And we'd like to delineate in this task force what the current status is and take it from the historical perspective into the future.
What would you say is a key benefit of being part of EACI? I think I know what the answer is.
I think it is very good to sit together with a bunch of enthusiastic people, partly experts, but partly also juniors who are just starting their career, but who are very anxious to participate in all these initiatives. So I think it unites people within the area, across the areas also, because everybody has their own expertise, and brings us together to work on projects, on focus congresses, on the annual congress, but also on task forces.
You've been involved in the subject of asthma for a couple of decades, as you told me. What makes you as excited today, as you obviously are, as you were when you started in asthma?
I think this is also a very important question, because when I started as a PhD fellow at Peter Sturck's, and he is the godfather of EuBioPret, and obviously this is the way how we now start to look at asthma. So not from the rigid Oslerian, if you wish, prototypes of diseases, but unraveling this in the small molecular pathways and components, and build on these components the clinical insights and hopefully also targets to treat patients in a correct way, in a personalized way. So for me, what has been very nice to see, back to my PhD thesis like 20 years ago, more than 20 years ago, I was privileged to work on one of the first targeted therapies in asthma, the cysteine and leukotriene receptor antagonists. And now I have been involved in the development of other biologics in small molecules. And I think that was really nice to see that this concept has been taken forward, but also has been underbuilt with new evidence on the pathophysiology and immunology.
Zuzana, thank you very much indeed. Great to talk to you. That's all from EACI TV for now.